How does drug abuse affect mental health? These two things are inevitably tied together. Generally, mental health, a person doesn't have to have an illness to resort to using drugs, but at the same time, a person using drugs doesn't necessarily cause a mental health illness. But there are certain features that are related to the two. So mental health things like previous trauma, and we talk about childhood trauma a lot, that doesn't necessarily need to be a major one-time trauma. We talk about post-traumatic stress disorder. This can also be stresses that are slow and steady and have been present many days, so peppered by traumas on a daily basis. So the poor handling of stress is, to me, is the biggest issue that leads users to taking more and more use. They want to escape. It's used as a crutch, the drug of choice. Typically it's either cocaine or opioids that are the ones that are abused the most to try to escape from the daily stressors that go on. So mental health can predispose a person, meaning that they can have daily traumas or previous childhood issues or coming from a broken family. It can lead them to more use because they're trying to medicate away problems. They never learned effective coping mechanisms, and so the two can be tied together. As far as mental illnesses, drug use like cocaine can cause psychosis or schizophrenia. So this is a well-known thing. Drug use can also worsen other mental health issues like anxiety. So that example is a circular issue where they have anxiety, they want to resort to their drug use to help allay the anxiety, but really the drug use is worsening the anxiety. So this is what typically happens. It's a double-edged sword. Add to that, a person going through withdrawal can end up feeling extremely anxious, especially from the opioids, because this is a syndrome now called dope sickness, withdrawal, whatever you want to call it, where it is complete opposite of the enjoyment they had when they were using. When they're going through withdrawal, everything is the opposite. So there's fear, paranoia, anxiety. All these things tie in together. So to summarize, mental health and addictions go together. Addiction is a form of mental health. Certain mental health issues like poor coping with stress or childhood issues can predispose somebody to drug use later in their life. And then drug use itself can worsen mental health issues, whether it being anxiety, psychosis, bipolar, or other mental conditions.
We've helped over 1 million Americans completely recover from substance abuse. Call now at 1-800-615-1067. Call now.